Thank you very much, Jennifer, for your very nice presentation. And now we move to the next presentation. Well, Jennifer has referred several times to the interactions between NCI, NCL, and FDA. So now Susanne will present, let's say, what has been initiated within EUNCL with the different regulators.
Yeah, thank you, Patrick. Before I will start, I just want to present shortly my organization. I'm from the Joint Research Center, that is the Commission's in-house science service, and we are providing scientific technical support through the European Commission throughout the whole policy cycle, starting from the conception through the implementation and the monitoring of policy cycles. And we are very interesting and stimulating innovation through the development of new methods and tools and standards. So in this context, we came across the nanomedicine field some years ago, and we decided to embark on that field in order to support the translation of nanomedicine. So we want to manage and use existing knowledge in order to anticipate the regulatory needs. We want to elucidate which kind of methods, tools, and standards are necessary for the regulators to make a decision on the nanomedicines. And we also contribute with our own laboratories on the development and validation of such methods. And of course, we act as a JRC as a platform for discussion between stakeholders. So it was a strategic choice for us to participate in the EUNCL. Patrick has demonstrated already here the workflow or the interaction with the different groups, and for us, we take care on the regulation, on the interaction with the regulators. So when we interact last year, or when we started last year on the EUNCL, we joined an existing network, and you have heard about that already yesterday with the regulators. It's the International Pharmaceutical Regulators Forum that have established a working group on nanomedicine. So we joined this group as our own agency, the European Medicine Agency, and the FDA as well. And since both NCLs, the EUNCL and the NCI-NCL, have interaction with their agency, we automatically can support, as Jennifer already outlined, the standardization of protocols and support the mutual acceptance of data. So very briefly, the objectives of the IPRF Nanomedicine Working Group are to share non-confidential information, to stimulate regulatory cooperation and work sharing, and to collaborate of training organization, and to promote potential consensus finding. We are participating in the work program of the IPRF by a compilation, mapping, and discussion on terminology, by the exchange and mapping of critical quality attributes. We have heard about the importance of critical quality attribute from Caroline, and we also performed the first EUNCL survey with this group. So I will now introduce very briefly the current state of this work. So terminology, a common language, is essential for a harmonized regulatory governance. It's needed for the standardization of quality and toxicological tests. It's necessary for an effective review for policy making and research granting, for patent searching, and so on. So what we have done up to now, we have used our own competence center of text mining and analysis and crawled 10 regulatory websites participating in the IPRF working group, and assessed the frequency of nanoterms per site, and also try to understand the relationships between the different terms. And then we have started to manually extract important nanoterms and their definition. So what we already see, and gives us an idea on the scope of the problem, is if we look on the computed frequency of nanoterms per site, if we look at the term nanomedicines, that is used in Europe, but it's not used so much in the FDA or in Health Canada or in Australia. So in the context of talking to each other between the regulatory authorities, understanding of the regulatory bodies is quite important. So, and that goes on if we then look into how do we name this product? products we are talking about. In Europe, we talk about nanomedicines. In the US, they talk about nanotechnology products. And in Australia, they talk about therapeutic products containing nanomaterials. So we need to be aware of these constraints. So the next part we did, or the next task with the IPRF working group, was the EUNCL survey. So we raised 30 questions addressing the current status of applications, the first recommendations, the expectations, and we asked 18 competent authorities. 10 of them responded, and you will see the full information in a technical report of the JRC later this year. Just two results. We ask what are the functions that an EUNCL should fulfill to support the translation of regulatory authorities, and what was upcoming is that they want to see a testing facility, but they would also get information on the test method validation, so how reliable and relevant the methods are that we are using. So, and both is addressed by the EUNCL. Of course, that's our core business, to be a testing facility, but as Jennifer already outlined, we also participate to the test method validation, getting information how robust a method is. So, and another question that I raised was the physical-chemical properties, which are relevant for a regulator to make a decision-making. So that are predefined parameters that I extracted from regulatory documents like EMA's reflection paper. And what we found that the regulator responded that some of these the relevance of some of these parameters are already part of the EUNCL testing cascade. So we heard already from Caroline the relevance of the critical quality attribute. They are connecting the manufacturing process with the safety and efficacy of the drug. They are defined in ICH guidelines. I will not go into detail there. And what we have done, we are participating in the exchange and mapping of general critical quality attributes together with the FDA and the Authority of Japan. And I went to the European Medicine Agency and reviewed 15 common technical documents. I extracted the critical quality attributes which were regulatory accepted of 7 dossiers. And if you look at the critical quality attributes, here are the ones which were named at least twice. And if we map them against the testing cascade of the EUNCL, we can see that to a wide extent the EUNCL is covering the critical quality attributes which are accepted by regulators so far. So in summary, the EUNCL supports the advancement of the regulatory science of nanomedicine by providing standardized method. The testing cascade that we have is of regulatory relevance. We contribute to the harmonization of protocols with the NCI, NCL, and support by this the mutual acceptance of data. But we are also contributing to the development and validation of new test methods relevant to assess the quality and safety of the next generation of nanomedicine. And Sven will tell us about that in the next talk. So I would like to thank the EUNCL survey, have done together with Sven and of course the EUNCL consortium and also with the agency that responded to our questionnaire. The terminology is done with my colleagues at the JRC, and the critical quality attributes I did with my colleagues at the European Medicine Agency. Thank you.